So let's talk about diabetes, because this is what your book is all about, the circadian diabetes code. And as a gerontologist, I'm really concerned because, as you mentioned, 1 in 3 people in the US or 1 in 4 globally either have diabetes, elevated blood glucose, or is at risk. And many of these people are in low and middle income countries. And what many people don't even know, they may even be pre-diabetic because they're not testing themselves. And the CDC has even said that diabetes was the 7th leading cause of death. I think now, because of COVID, it's the 8th, but it's definitely on the rise. And in your book, you've mentioned how sleep and exercise and fasting can help with this. So maybe we should start with the fasting, because let's explain a little bit more how fasting can help someone lower their diabetes risk or even reverse it.
Yeah, so let's begin with some clarification. Diabetes is not the 8th cause of death. It may be actually 2nd or 3rd, because heart disease kills people as the number 1 cause. And many heart disease patients actually have underlying diabetes. And diabetes is the first step for many people to get into heart disease. Similarly, diabetes also exacerbates several conditions of cancer. And obesity and diabetes are a risk factor for cancer. And cancer is the 2nd cause of death.
And
for
even
COVID-19,
Alzheimer's. Yeah. I was surprised 80% of people who have Alzheimer's have diabetes. Like, that's a number that blew my mind.
Yeah. And then similarly, COVID-19 patients who succumb to their disease, many of them, people say they had underlying condition. And sometimes the underlying condition is diabetes or heart disease. So diabetes is the gateway, is the gate that opens to go through that sliding path to many other diseases. So now fasting, although you use the word fasting, I just say that it's not fasting because you're not depriving your body of nutrition that it needs. You're actually offering the body the escape from excessive nutrition that you are flooding it with. It's almost like if you want to grow a plant, we know that the plant needs water, but you cannot put your rose pot submerged in your sink and expect it to grow. And that's exactly what we are doing by feeding ourselves all the time food. We are submerging our rose plant pot in the sink and then expecting that this is going to grow. So fasting, let's think about what happens. Diabetes is when we produce more insulin, and that insulin is ineffective in letting tissues absorb and metabolize appropriately the glucose. And insulin goes up only when we eat, and when we eat something that has carbohydrate. Since most of our food, particularly food that we eat from plant sources, have at least 50 to 70% carbohydrate. That means everything that we eat will likely trigger release of insulin. And we cannot expect to eat only meat and other stuff all the time. And it takes only 1 to 2 grams of carbohydrate to trigger our pancreas to produce that insulin. And that 1 to 2 grams can be 1/3 teaspoon of sugar that you may be putting into your coffee or tea. So that's as a tiny amount of food that actually triggers insulin release. So in a way, if we give our body rest from food for 12 to 14 hours, then we are essentially telling our pancreas not to produce insulin during those 12 to 14 hours. And our cells in our body will get primed to insulin function, so that when we eat, even with a little bit of insulin, our muscles and liver and fat cells, all of them will be ready to absorb that glucose quickly, so our blood glucose will not rise. So that's one way that fasting, staying away from food for 12 to 14 hours will help reduce the excessive insulin production, prime our cells to be more sensitive to insulin when we eat. And that's a very simple, straightforward approach. And then as we are learning more and more, we are also seeing that during this fasting period, the pancreas repairs itself so that it is more primed, more fit to produce insulin. Our cells prime themselves for insulin function, and also our gut, our immune systems, they also get prepared so that they don't lead to excessive inflammation due to leaky gut. So there are many other indirect benefits of giving yourself rest from food.
Yeah. So not only just for the diabetes, it's just in general, it's a whole systems approach where the whole body can just take a moment to
Yeah.
repair itself. And like you said, prime and be more sensitive. It just makes perfect sense. And in the book, you give great detail on how this. I encourage everyone to get the book and take a deeper dive because we just don't have the time for all of this.
Yeah.
But I appreciate how, the time restricted feeding, which we'll call that, and the fasting, because fasting just sounds so depriving. So it's just keeping it in a certain window. And you mentioned there is great flexibility with this, but starting with the 12-hour fast, I think was the most approachable and easy for people to get started. And then you work up to what works best for you. And I'm wondering though, is there any, in your studies, have you found any differences between men and women in terms of time restricted feeding? Is there different approaches? Do they react the same, whether they have diabetes or not?
Yeah, so these are important questions that we're asking right now. To begin, to go back when you said 12 hours, the reason why 12 hours is a good spot is if you just take a moment and just think, when was the earliest time you have eaten in the last 2 weeks? That earliest time. We're not asking when is the typical time when you eat. Earliest time when you ate or consumed any food that had even half a teaspoon of sugar or even a little bit of cream, then that might be 6 a.m. And when is the latest time, the last time you had food in your system and in the last 2 weeks, and that may be at 9 p.m. So there you can see that many of us, actually in a study, what we found is nearly 50% of adults in the US have that time window, the earliest and latest, around 15 hours or longer. So that means if you have 15 hours, then coming down to 12 hours is a big deal. And then if you can come down.
I think you said 10%, not even 10%, or
not even 10% yet within 12 hours. And then if you can come down to 10 hours, then that's a pretty good place to be in. Then the question is, are there differences between male and female? Of course, we can do much more controlled studies in laboratory animals, and many of our laboratory animals replicate very well in humans, and not the same magnitude. For example, mice can lose 20% body weight in time-restricted eating, but we humans, we don't lose that much, 5 to 10% max. So what we're finding in animal studies is when female mice are put on time-restricted feeding, that is 9 to 10 hours of food access for 7 days a week. Sometimes we have done it for 5 days a week, and it still works pretty well. Then both male and female mice are protected from diabetes and high insulin. They're also protected from liver disease. And this is very important because women are actually more resistant to liver disease. But once women get liver disease, fatty liver disease, then they get more severe form of fatty liver disease, and it also progresses much faster to non-alcoholic steatohepatitis and liver cancer. All those things happen much quicker in women. And what we're finding in mice is time-restricted feeding equally protects both male and female mice against liver disease. We also found there are many other benefits. So for example, the female mice are much better protected against infection because the time-restricted fed mice at the end of 12 weeks of time-restricted feeding, we challenge these mice with LPS, which is a bacterial component that triggers inflammation and can cause death. And what we found was time-restricted fed females were completely protected. Only 5 to 10% of mice died because of LPS challenge, whereas the male mice, usually if they eat ad libitum, nearly 80% die. And if they are eating time-restricted, then 50% die. So compared to males, females are much better protected against inflammation and inflammatory disease under time-restricted feeding. The one thing that we did not find, which might make many people a little sad, was time-restricted feeding did not prevent the female mice from gaining slight body weight gain. But there is a caveat. Female mice are always much lighter in weight than male mice, and they actually don't get as fat as male mice, but they do get a little bit of body mass. What we found was even though they did not reduce the body weight, the fat was much better than the ad libitum fed mouse, because in these days we know that there are two different types of fat, the brown fat and white fat. White fat is the one that's bad. because brown fat has more mitochondria, what we found was time restricted feeding increased mitochondria content in fat cells, and also in the female mice, time restricted feeding completely removed all the inflammatory cells in fat, because we know that the fat, partly it is bad because a lot of inflammation in fat, and time restricted feeding kind of reduce that. So the bottom line is animal experiments are telling us that when animals are put on time restricted feeding, then they're protected. Both male and females are protected from many, many different kind of disease. The female mice may not be protected as much as the male mice are from weight gain, but female mice get the bonus of having healthy fat, more mitochondria, and are well protected against inflammatory disease. And that's what matters. Means at the end of the day, it doesn't matter whether you wish to lose some weight or not. If you're healthy and if you're protected against many inflammatory disease, that's what will improve the quality of our lifespan and our performance.